A negative COVID-19 test result does not mean you're in the clear. Health experts are warning that if you have symptoms, you should consider going for a second test to ensure if you are COVID-19 free. Let's understand why. Head of the Center of HIV and STIs at the National Institute of Communicable Diseases, Prof. Adrian Puren, joins me now to explain. Prof, please give us some clarity on this. What scientific progress of the virus in the body allows for a test to be negative if a person is displaying symptoms, and what are the time periods involved?
Yeah, so it's really a complex question in some ways. However, when we have high rates of infection, as we are currently seeing in various parts of South Africa, what is called the so-called pre-specified probability that someone who presents with symptoms has COVID will be very high. So we have a very high sensitivity of specific tests, and for example, the current reference tests are the so-called PCR test that has a high sensitivity and high specificity. So the likelihood that if you were to go to be tested in areas where there are high rates of infection, then your test will likely be positive. However, under certain circumstances, remember that these signs and symptoms can be presented by other viruses as a result of other infections, for example. And so that may be, one reason for having a negative test. It could also be technical problems, for example, if the specimen was not taken appropriately. So that could well miss it. If it's in the early phase of an infection, again, it's unlikely in the case of PCR that it would be missed, but given the high sensitivity of these particular tests. However, we've also introduced in South Africa antigen tests. These are less sensitive, but they perform as well as, especially in individuals that have a number of, for example, signs and symptoms. So I think you need to take all these factors into account rather than saying that you may have missed the test, therefore you should retest. So I think it's really taking all those factors into account before we simply say, if your test comes back negative, that you need to retest. I think you really need to take those factors into account before recommending retesting.
As a layman, it's very difficult to make those kind of decisions based on very little scientific experience or expertise. There's a lot of information out there. There's also a lot of confusion out there. And as you've said, the symptoms displayed under COVID-19 are very similar to symptoms from other infections or viruses. So is there a recommendation for people to get a specific test that might be more specific or accurate than other types of testing?
So the current reference test is the PCR test for COVID-19. So if that does come back negative and there's a high level or high degree of suspicion, the clinician can make a decision. And that decision would, for example, say, okay, we can retest if it does return negative, but I do think that you have COVID-19 infection. Then the following step is that you go into isolation. So you can make clinical decisions as well. I think trying to do additional tests such as virus culture and things like that, I think is not appropriate. I think it really comes back to the fact that if you're in a clinical setting and you think that there's a high degree of suspicion despite a negative PCR test, then you can certainly take the step and say, well, you should go into isolation. What you could do next after that individual has gone into isolation is, for example, do a serology test. And that may then assist in terms of confirming whether or not indeed this person has been infected with COVID or actually may not have had a COVID-19 infection.
Professor, what's the recommendation with regards to contacts or workplace exposure? If I had been in contact with someone who had tested negative but had displayed enough symptoms of COVID-19 for there to still remain some worry that they might in fact have COVID-19, what should I as the individual be doing? Should I, as a matter of course, be isolating? That can sometimes be difficult given where we are with people's salaries and the lack of leave available to people.
Yeah, so again, I think this is all about managing risk, and I want to distinguish two terms. You use the word isolation. So if you were the individual that's not displaying any signs and symptoms, but have been in contact with a person where there's a high index of suspicion of COVID-19 infection, then the recommendation is that you would go into what is called quarantine. And the quarantine period, I know that there's debate about this, but I think for South Africa that has now been also reduced to a period of 10 days. And during that period, if you do not display any signs and symptoms of COVID-19, then you can come out of quarantine. However, during that period of 10 days, if you, as the individual, has been exposed to a person where there's a high index of suspicion or a confirmed PCR positive test, then you need to observe your signs and symptoms. And if you develop signs and symptoms during that 10-day period, the recommendation is that if you have access to testing, that you actually go and test. So again, I want to come back to this point about being in contact. So I think, for us, the definition is close contact. And that close contact, in my view, is being face-to-face with an individual for at least 15 minutes, less than a meter in proximity, and not wearing a mask. That, to me, is the high-risk scenario where you want to take those particular actions. But again, you need to assess what we call the risk situation. So again, in the workplace, again, it's very clear what steps need to be taken. So in other words, it's clear what steps need to be in place to protect each and every individual. And if there's adherence to those particular steps, such as, for example, being a meter or 2 meters apart, the wearing of face masks at all times, especially when in contact, good ventilation, those all reduce risk. So when someone says X person has had a positive test for COVID-19, you then methodically and carefully manage the risk. So if you've been in another office, which has been well ventilated, then your risk is low, and therefore you should not be going home and quarantine. However, if within that office space the distances have been less than a meter, again, close contact in the absence of masks, then you need to assess risk, and that individual then may well have to go into quarantine. So I think it's really managing risk very carefully and clearly and methodically in order to not shut down workplaces, not shut down offices, in order for matters to proceed.
Well, thank you very much for that clarification, Professor Puren.